off-label treatment without proper studies.
Okay. I want to take an opportunity to take another question from online. Maybe Dr. Kamen, if you could speak to this. Cheryl from New York is asking, is there anything besides surgery that might be effective in addressing with the problem of the constricted veins so that surgery would not be necessary?
I am not aware of anything other than what you're calling surgery, but what I would call interventional a procedure, yeah. A non-surgical interventional procedure. So I'm not aware of anything other than that which would help with the venous narrowings.
Okay.
From my perspective, you know, the intervention that has been carried out is a relatively straightforward one. So it is not something that is difficult to do, but we would certainly, I think, not undertake it or not advise it without the recommendations of a clinical neurologist who knows the patient and is willing to follow them and objectively assess their improvement. So if there's no clinical trial that we can participate in, the minimum is a registry with the support of the neurologist following the patients and documenting outcomes.
Okay. Thank you. Thank you very much. We'll take another question from the press.
Hi, Pauline Dakin from CBC Radio. There's been a suggestion from some researchers that the placebo effect in MS can be as high as 50%. I'm just interested in hearing reaction to that, both from either Dr. Zamboni or Dr. Zavadnov and also Dr. Miller.
Well, maybe I'll tackle it first. There's a high placebo response in almost any condition in which there are subjective symptoms that a patient has. And many of the symptoms that MS patients have are undoubtedly real, such as fatigue and pain, but we can't measure them readily at the bedside. It's those kinds of symptoms that tend to be most responsive to any intervention, be it a medication or a procedure or an exercise regimen or anything. The placebo response is much lower in the objectively measured neurological changes, such as strength, spasticity, incoordination. Even there may be a minor placebo response, but it's usually not persistent and it's not very strong. In addition, we also have the benefit in MS that MR is a very sensitive indicator, particularly in relapsing remitting disease, to the effects of therapy. We do see in almost every trial that is conducted with medications that there is a decline in both the placebo and the treated groups in MR activity, which probably reflects entrance criteria of more active patients going into the trials who have a natural tendency then to decline. So I applaud Dr. Zavadnov and Dr. Zamboni for encouraging the need for properly controlled trials. And that's very difficult when you have an intervention, because to do an ideal controlled trial with an intervention, you really need a sham control. Patients need to not realize that they're actually getting or not getting the intervention.
Thank you, Dr. Miller. We have another question online from Kim. She wants to know, are there certain symptoms that we who have MS can recognize if we have CCSVI so that we can go on to further diagnostic testing? I'll just leave that as an open question in case someone wants to.
I mean, in terms of the epidemiology, we are looking on many things at the moment. The CTVD study was very rich from collecting the data that are really connected both with symptomatology and environmental risk factors, from the vitamin D to the HLA to the smoking, everything that we had almost 300 question long questionnaire that collecting everything what is connected with the risk to MS. In terms of certain symptomatology, that's, I think, a very relevant point, because we need to know and we need to work on a certain pathways that might be connected with a certain obstructions One pathway that comes immediately to my mind is a pathway between the jugular vein, optic nerve, and the pulvinar nucleus of thalamus, because it's the same pathway. And if you think one of the most frequent symptoms in this disease, at least in earliest phases, is the optic neuritis. So I know that Professor Zamboni and we too are looking on those, let's say, regional pathways.
I wanted to ask, optic neuritis, I think was the word you used. Is there something in lay terms? So
alteration of a vision.
Okay, thank you. I'll take another question from the press.
Hi, Amy Schoenfeld from Clinical Neurology News. Can you give me a sense of the scope of what's going on? How many patients are actually undergoing so-called unauthorized procedures outside of the research studies, and what specific procedures are they going for, and where are they going for these procedures?
Feel free to jump in.
Well, I don't think, certainly from my perspective, that we have any idea of the answer to that. We know that among the community of persons with MS, there's a lot of interest and inquiry, but there's no current requirement or registry, as Dr. Kamen suggested, established. So we don't know how many are going, where they're going, and who's doing them at the moment.
Yeah, but this is a very important point, and that's why I said before that clearly we recommend to all those people who are doing those things to get their IRB approved, to create their registry, and to really connect with the neurologist in a team research based on this. I think that at this important forum we need to make clear that those people who are doing that probably will not benefit this research in the long term if they don't follow certain really, fundamental ethical rules how this research should be done.
Regarding the registry, we are preparing a registry, and this could be a good tool for know exactly the amount of the procedure done in an upper level fashion, and probably to reduce phenomenon of malpractice related to this kind of procedure.
I would like to comment that a registry is very important for patients who are done outside of controlled clinical trials, but it's absolutely no substitute for the rigor of a properly controlled trial where patients are examined under standard conditions and whether it's randomization to a procedure or a non-procedure.